Okay, good morning, everyone. This is Phil. We're going to go ahead and get started with our monthly coalition meeting. Uh, this one should be fairly quick today, as I don't have a ton. So hopefully, we'll be able to hear from the good folks out in the community and across the coalition if you have any things to bring to bear here. So we'll go ahead and get started. As a reminder, administratively, if you're not talking, please make sure that your phone is on mute so we don't get too much background noise so we can hear those who are speaking. And again, another friendly reminder with IMATS, if you have not logged into your IMATS within the last 90 days, you may not have an account anymore. So please log into IMATS and make sure that you got everything squared away. All right. So skip past a few things, get right into our traditional roll call agenda. We'll start with our hospitals. We'll start with Anderson Hospital. Anyone from Anderson? All right. No one from Anderson. How about Alton Memorial?
Good morning, Phil. This is Aaron from Alton.
Stand by 1 second, Aaron. I saw you flash, but didn't hear you. 1 second. All right, let's try that again. So I'll run back to Anderson just to double check if Eric is on. Not hearing Eric. I see Aaron. You're on.
Yes.
And I heard you gotcha loud and clear. Over to Boyd.
Nancy's here.
Gotcha, Nancy. Who's next? Carlinville Area Hospital. How about Staunton? Again, I'll give Eric one more shot. Nope. How about Fayette? I see we got Tina on.
Yeah.
Gotcha. What about Gateway? We got Rick. Okay, got Rick on. And I don't know if Danielle's on as well.
No, she's out of town today, unfortunately, so you're stuck with me.
All right, that's great. That's why it's rain. That's why it's pouring right now. You're stuck with Rick, right? No, I appreciate
Great
you, Rick. Thank
cloud.
you. HSHS family out here. We'll start with Holy Family.
Cindy's here.
Gotcha, Cindy. How about St. E's? No one from St. E's. Okay. How about St. Joseph's Breeze? And what about St. Joseph's Highland?
Patrick from Highland, but I'm gonna have to step off early. I apologize.
Okay, no problem, but thank you for jumping on, Patrick. Over to Jersey Community Hospital.
This is Nick from Jersey Community.
Gotcha, Nick. Thank you. Who's next? For Morehouse of Bella, you got myself, Scott, Lee. We're all here. Mike is out of town. And for Shiloh, we're covered. And I see we have Georgia. Are you on?
Yes, I'm here.
Gotcha for Chester. How about OSF St. Anthony's? Anyone from St. A's? Nope. Red Bud? Anyone from Red Bud? Nope. Okay.
Christy's here.
Oh, who was that?
Christy.
Okay, gotcha, Christy. Thank you very much. And Sparta.
Dale from Sparta's here.
Gotcha, Dale. Thank you. And Touche.
Hi, this is Amy. I'm not on Teams. It's not working for me, so I just called in.
Okay, no problem. Gotcha. Anyone else from hospitals that we may have missed? Okay. Health
Hi,
departments.
Phil.
Oh, go ahead.
I'm sorry. I probably got ahead of myself. Helen from SLU is on.
Yeah, you're ahead of yourself, but I got you, Helen. Thank you.
Thank you.
No problem. How about Bond County Health Department? Calhoun County? Calhoun, okay. Clinton County? Eastside Health District? All the health departments are out partying with Beth, must be. Okay. Fayette? Greene County? Jersey? Yeah, I'm picking up speed. Macoupin? Madison? Monroe? Randolph?
Hi, Phil. It's
Thank-
Vicky with Monroe County.
Hey, you're working today. Thank you.
Well, most of the county is in Peoria for a CRI meeting.
That's what I remember. Beth we talked last Friday, I think. Yeah. So okay. I'm gonna talk about you today, Vicky. Just so you know, I got some either some good news for you, or I don't know what kind of news it is for you, but we'll talk about you here in a minute.
Okay, thanks.
I'll keep you anxious. Sorry.
Okay.
Our community partners, our RMSC is Greg on.
I am on, Phil.
Thank you. And I take it Beth is not. She's out. Our BJC partners, I see Jason Campbell's on. Anyone else from BJC?
Yeah, Phil, Sean is on.
Gotcha, Sean. Thank you very much. And any of our, okay, who was that? Okay, I got you, Deborah, Randolph County. Gotcha. I see we got Sam from here in St. Clair County, EMA. Any other EMA agencies on?
Keith from Jersey EMA is here.
Keith, what's your last name?
Norman.
Norman, gotcha. Already got you in here. Perfect. Thanks, Keith. Thank you. Anyone else? EMA. How about our good folks over at MedStar Ambulance today? Anyone from Abbott? Yep, I got you, Sam. Thank you. We already got SLU. Thank you. Scott Air Force Base. I don't know if Tim's been making it today. And anyone from STARS?
Phil,
Okay.
okay.
Who was that?
This is Nick Holbring. I'm not with STARS, but I figured it's a good time to jump in. I'm with St. Charles County on this side of the river, but representing the Healthcare Coalition along with Jason.
Okay, gotcha. Thank you. Hey, appreciate it. Get you in here as well. Okay, much appreciated. All right, we'll go ahead and get started. If anybody else jumps on, just put it in the chat, and or we'll get you at the very end. We're going to go ahead and start off with the IDPH. Any updates, Greg?
Morning, everyone. Just a couple here. I may have announced this previously, but Bobby Van Bieber is the new chief of EMS and Highway Safety, who replaces Ashley Taylor. Ashley will still be hanging around for some time to get Bobby up to speed on everything, but he's doing really a great job for being here just a few weeks, so that is a positive. Also, Dan Lee, who is our data guy. I think many of you might have worked with him, excuse me, on EM Resource and things like that. He is back on a contract after his retirement. He'll be working Tuesday, Wednesdays, and Thursdays. So if you do send him an email about something, just be aware that he is only here those 3 days a week. As for EM Resource, I believe an update went out to everybody, a siren notice. They have switched the way they sign in to everybody using their email address. Many of you probably may have already been doing that, so it really doesn't concern you. But if you were signing in with something besides an email address, you should have gotten an email or the email that was in the system for that sign-in to notify you of how to migrate to using your your email address as a sign-in, and that was a safety switch to maintain the integrity of the system. And the final thing, I just wanted to let everybody know, sorry, I've got a frog in my throat. Pulse Form was updated last year. I think they revised it again in September. IDPH did send out some education, PowerPoint, and some education to all of the EMS system coordinators. Please make sure you share that with your providers who may not know about the update. The biggest thing on it was the fact that it no longer requires a witness to the patient's signature. And if anybody would like that for their hospitals, just shoot me an email and I can forward that if you already didn't receive it by some other means. And other than that, that's all I have, Phil.
Thanks, Greg. Any questions for Greg? I see one hand up. Tina, go ahead. Tina, if you are talking, you're on mute. I did see your hand up.
Good morning. Do you hear me now?
Yep, got you loud and clear. Yep, we got you. Go ahead, Tina.
So the Javari that happened, I did get my welcome letter. It was, and I had to work with them to migrate. But all the house supervisors, there was 3 here last night, and we went on. They did not receive a welcome letter. I did email Javari in regards.
Hey, Tina, were they all signing in with the same sign-in? I don't know. Did we lose Tina? Phil?
Tina, I think we lost your microphone, Tina. If you were speaking, if you were still talking, we lost you.
Is it better now?
Yep, I got
Yeah.
you.
So we all had the old way of doing it with our first name and then the period and then our last name. So and everybody's email had been checked, and I did get a welcome letter because that's the old way we did it. And mine, I had to work with them a little bit to get it fixed, but none of the other house supervisors. So right now I'm the only one for the organization that can access that. I don't know if anybody else was having the same issue.
If you were all using the same sign-in, like username house supervisor, that welcome would have only gone to, because only one email address can be in there, it would have gone to that one person. So if everybody was using the same sign-on, they're not going to get a welcome email.
No, everybody has their own individual sign-on and password, but none of them got the email that I did. So,
Okay, were they already signing in with their email address?
no. So that's why the welcome letter for them to go in and they have to activate their account. They can't do it the other way because we didn't do it. But I did get one. I was able to upgrade mine or do mine, and I can get into the new platform, but none of them received that email. So I did send an email out to Javari this morning. I didn't know if I needed to send it to Dan also. So they all.
Yeah, I would think sending it to Javari will, if you sent their names or email addresses, and I would think that you're going to get a response from them since that's internal to their system and their update, and they're actually doing this all across the country. It's just really Illinois' turn. So I would think you're going to hear back from them, but certainly if they don't hear back from them, then we need to reach out to Dan Lee. Sorry, I don't have a better answer. You're the first one who's had a question, but if I hear something, Tina, I'll get back to you.
Thank you, Greg.
All right, thank you, Tina, and thanks, Greg. Any other questions for Greg? Okay, hearing none, we'll go ahead and move forward. Again, I know Beth isn't here, but maybe if any of the other public health departments had any announcements, this would be a great opportunity for you to make those announcements.
Hey, Phil, it's Vicky. I don't have anything to update.
Okay, Vicky, thank you. All right, hearing no one else, we'll go ahead and move on. Anyone from STARS? Again, jump on. Going once, twice, thrice.
Nick, do you want to take point on some updates, or I'm happy to speak up too?
Yeah, Phil, if you want, if this is a good time, we can touch real quick on some Missouri Side Healthcare Coalition stuff, which is under the STARS umbrella, or we can do that later.
No, this is perfect timing. You do this right now.
Okay. Jason, fill in anything I miss. But first of all, hi everyone. I have not been on this meeting before, so I appreciate the invite from Lee. My name is Nick Kohlberg. I'm a planner with St. Charles County Health Department. So just a couple things from the Missouri side of the river. We are probably the biggest thing lately that we've been working on is updating some of our response plans. We during 2022 met with several different coalitions around the country, including Phil and Lee, about how you all manage responses to various things, and we wanted to try to improve how we do things on our side of the river. So we are working on implementing what we're calling a healthcare multi-agency coordination system, essentially just trying to get a one-stop shop information hub for the coalition so that we can have a little more strategic direction for things, or at least a place to have information come in and then be disseminated out as well. So we're working on educating all of our stakeholders on that and getting that to be the standard, hopefully on our side of the river. We are working on getting some strategic planning going as well, identify some priorities that we'll be working on. I believe, I can't remember, Lee, if you're a part of that group or not, but Lee is a frequent volunteer to support things that we do, so we're appreciative of that. And then the other thing I'll mention is we're working on doing an assessment of our various caches that we have around the region. I'm sure you guys are similar in having lots of different trailers and all kinds of items that are out there. So trying to get a handle on that as a coalition holistically, and then evaluate what capabilities we want to try to achieve and where we have our shortfalls. So that is spinning up actually tomorrow. And so I'm sure we may have some questions for you guys on how you do things. Again, I believe Lee is involved in that and can provide some insight. So that's all I have. Jason, if there's anything you want to report, or if there's any questions, we're happy to take those as well.
No, Nick, you covered most of it. The only other addition I'd have is our strategic plan meeting that you referenced is next Monday, the 10th. And another initiative that we're working under the umbrella of UASI is a regional healthcare professional emergency management academy. We had a great meeting with partners and stakeholders last week. Lee was participatory in that, and I think we aligned on some solutions that can benefit both of our jurisdictions on both sides of the river. So our next regular meeting is Friday, April 21st, and Hope partners, Hope leaders are invited to participate.
Thanks, Nick and Jason. Any questions for the crew? And we will try to, future wise, separate. And I should have did this one, but the next one I'd like to give you guys an opportunity to speak from the coalition perspective, because STARS is a big umbrella, and maybe we can separate some of that so we can get a more clear message from each entity there. So much appreciated for the updates and the continued collaboration across the river. So any questions for the two gentlemen? Okay, hearing none, we will move forward with our next. On the mental health front, I will say this, I'll just make a couple notes here. We've been doing a lot of CISM training. As you guys know, that was a critical success for us, I would say, from a coalition perspective. So we're going to try to continue to do that in the outgoing years. I'm trying to find some room in the budget this next year to provide 1 or 2 more courses this year coming. I just encourage each and every one of you to reach out to your providers and make sure that we're shoring up our critical incident stress management team, because it's like the few, the proud, the Marines. You know what I'm saying? That's you have a very small team that does a lot of work, and we'd like to be able to equally balance that load across the coalition and give more timely debriefings and the like to providers across the region. We hate to skimp on availability. So the best ability is availability sometimes. So again, I would encourage you guys to look out there and see if you can find some folks and just send them my way. I'll put them in contact with Karen here and definitely get them started with CIS team and then get them more and more training as we go forward. So thanks for all the support in that regard, and hopefully we'll continue to look out for the mental health needs of our providers out there on the front line. So any questions, or does anyone else have anything to add to our normal mental health updates? Okay, hearing none, we'll go ahead and move forward. Pediatrics, Scott, got any updates this month?
No updates from me right now.
All quiet on the pediatric front. Okay, got it. Remert, again, Mike is out right now, so I'm going to toss it over to Lee to see if he had any updates from a Remert perspective.
Yeah, good morning, everyone. So from a Remert perspective, yeah, we are pretty well task saturated for the next couple of months. We've got our work with the folks from Scott Air Force Base in preparation for their air show, followed immediately thereafter by actually even before the air show, we have our week-long austere training that we're doing, which will bring all of our special operations EMS folks well above and beyond what the traditional scope is in EMS. Then we go directly into the air show, then NASCAR, Indy, along with a couple of other events that are playing out, like the State Police Youth Academy, things of that nature. But overall, we are staying busy, training as usual. We did just conduct a moulage class in the region yesterday and Monday. We had several folks from Remert in attendance for that. And yeah, overall, we're just keeping on.
Perfect, thanks. And while we're talking about that, or about the moulage class, Lee was in the class yesterday. I was teaching decon here, and Scott was teaching decon with me here, and he gave me raving reviews from his wife who was in attendance. So if there was someone other than Lee, because he's not the artsy fartsy kind of guy, he says I'm that part of the team here. So I'm gonna reach out to Aaron or anybody else who may have been a part of the training yesterday. Want to give any feedback while we're talking about it?
Sure, Phil. This is Aaron. I enjoyed the class immensely. Have done a lot of moulage over the years, kind of mostly self-taught or kind of like on-the-job training with moulage. So it was good to have a kind of a professional approach to it. Covered a lot of ground in the 2 days. and then a lot of different types of injuries, and then kind of the, how to develop a kind of a story around the injury, so that when you're doing the moulage, that your victim in the exercise is telling more of the story, and that you're cohesive with your vital signs and what you're trying to, and what your intent is with the scenario and with the patient. So enjoyed it a lot. I would probably recommend a few more rounds of it. That's kind of my brief assessment.
Perfect. Thanks, Aaron. Yeah, and I see Jason saying he loves the concept of telling the story behind the injury, to bring some of that realism to whatever those exercises that we're conducting, whether those were, region-wide exercises or just some things in a hospital. I'll speak just briefly on the impact of telling that story and to those injuries, and the amount of realism that you provide with decent, or and I'll say non-Academy Award winning moulage. But we did kind of our Secret Santa Ebola patient here, when Eric was still here. His daughter, his wife, participated in a moulage, or they did some moulage on her, and it kind of really put the folks in, like, really in the zone. So those who were doing triage and the physicians that evaluated her did great, provided great patient care, but the realism of um, the moulage that they did, just as a little bit of home remedy stuff, very low level stuff, probably you can get at a Halloween store, but it really put the providers, in the zone, so to speak, and it worked great. So I highly encourage it. This was a fairly expensive class, so we probably won't run it this. We won't run it in this upcoming year, but it's probably something we'll try to do every 3 years. And with how we're partnering with our coalitions on the west side of the river, um, with Jason and crew, um, this is something that I think we can try to balance on both sides of the river to make sure that we're, we're spreading the wealth, so to speak, so folks have that opportunity and can create some more realism. So thanks for all those who attended, and I'm glad that was a success for us. All right. Just quick, I will say this regarding the upcoming budget, the BP5 budget. Next month, we will take a in-depth look, as we do every year, of where we're spending. This next year, we've talked about several of those things. One of those, we're going to have one major purchase item this year is going to be the upgrade to the telemetry set. That is in the neighborhood of $144,000 of the grant. But we did vote several months back to move forward with that, so that will be incorporated. That does squeeze us a little bit in other areas. So we're going to still try to bring in trainings. We may not be able to bring in as many paid trainings, but I know Lee's been working hard at, and I've been looking out for other federally funded trainings, state funded trainings that we can incorporate this year. I think we did a lot this year. I wish we could have did more over the earlier parts of the year. So that's what we're going to target this year coming up. So trying to have some trainings in the early fall, late summer timeframe starting, so we don't have it as congested in the middle to end part of the fiscal year. So next month, please be on the lookout. We will take a look at the full budget. As of right now, I can tell you I don't know what the dollar value is going to be, so I can't say exactly where we'll be at. But it is definitely something that we will look at this year, and we'll basically use our previous years if I don't have a dollar value. So we're going to just kind of back into this number as best we can. So if you see anything that you think needs to be included, I know we're not open for BP5 or FY24 BP5 project proposals anymore. But if there's something that that you think about and we end up getting extra money, please send it to myself or Lee. And I'm looking in the chat right now. Oh, wow. So these are, who uploaded those photos? Those are a lot, and that's pretty
Phil,
good.
those were mine. It's Aaron. Those were mine.
Oh, wow. So that's pretty awesome. That's pretty awesome. So yeah, did you guys get to keep some of that stuff, the kits?
There was a small kit that we were able to keep, and then anything that we made that wasn't actually put on our own person, we were able to keep. You know, the moulage pieces that we made off body, we kept.
Very nice, very nice. Looks great. There you go. So this Halloween, we know we're going up to Alton Memorial, and we're going to see if we can all get dressed out.
I'll take your reservations now.
That's great. All right. Any questions on the budget as discussed? So one thing I will ask here. So Vicky, I know you're still on. One of the questions that I did have, I just received from GMO yesterday. I just wanted to confirm with you your BP4 submission for reimbursements. Did you spend all of those funds already? Are all those funds already spent?
I did. I completed everything in March.
Okay, perfect. And how much of that have you received all of it?
I'm still waiting. I'm out of the office today. I was out yesterday as well. So I think I was just waiting on 3 shipments yet.
Okay. Okay. So I'm gonna touch base back with, just to let you know, I'm gonna touch base back with the GMO on it and just letting them know that yes, you did spend it. They may have you pause and submit your reimbursement for some of the things that you haven't received yet.
Okay.
Just to be on, but great on you. And I wanted to just kind of send a shout out to you and the team there because that's great execution on your guys' behalf. You know, a lot of times that gets pushed out and pushed out and pushed out, but I really, really appreciate you executing the funds, and you know, that was a lot of money to execute
Yeah.
on,
And
and
we
you guys did
appreciate
a
it.
great,
Thank you.
exactly, you guys did a great job. So I really, really appreciate it, and the paperwork looks great, all of that. So gold star for Vicky today. Thank you so much. All right. Open due outs, we didn't have anything really except for, I don't think Brad is on today or anybody from St. E's, but he was supposed to send over the actual race event calendar, the race car event calendar. I still don't have that, but everything else seemed to go out on time. So that one, as soon as I get that from Brad, I will forward it out. That iTrain link went out in the email this morning. I thought I'd sent it out like that day because Greg did forward it out. And I didn't know if he forwarded it out to the region, so I just re-forwarded it out this morning, so everyone should have those. And that was referring back to the KIMPAC training and the several modules that we have there for pre-hospital providers and host hospitals and those hospitals who would be requesting it. So that is out there as a reminder. So please make sure that you guys are in tune with that and you have an iTrain account so you can do that training. All right. As far as upcoming events, next coalition meetings on the 3rd of May. We do have some more first receiver decon courses going on coming up. A reminder for the VA DLX Field Hospital demo that is going on. That should say 25-26. Sorry, it says 25-16. Another first receiver class over at Gateway. Then we got the air show coming up. Again, reminder, Summit is canceled this year. And we're still targeting the Mercy exercise for July 12th. More info will be coming out, so we'll talk more about that next month. But for those who wanted to participate, we do have, your names listed, so we will be pushing out more information on that very soon. And another decon class in July and solar eclipse next April. So we're about a year out from the next solar eclipse. And with that, I'm going to open the floor to anyone. Any questions, concerns from around the coalition?
Hey, Phil, this is Helen.
Yes.
I can share with you that NASCAR weekend's going to be Friday, Saturday, Sunday, June 2nd, 3rd, and 4th.
Okay, I appreciate that, Helen. Thank you very much.
You're welcome.
Hey, Phil.
Yes,
Greg. Hey, and this is just a thought. I was just wondering if maybe in one of our future meetings, that maybe our St. Louis partners, because now, we have somebody from their coalition, may be able to just do a quick presentation on how they are structured over there. They have the stars, they have the SMOC, they have coalition, just how that kind of all lines up and who's all part of that, I think might be a good idea so that we can understand how they work a little bit better over there. That's just a thought. The other thing is, I heard you guys talking about the trainings and that have been going on. Just a reminder that if you guys are giving EMS CEUs, to make sure that any of those exercises or trainings are turned in so that we can get a site code for those folks, and those EMS people who participate can get some CEUs, because that's a great opportunity if you got EMS folks doing that. And maybe some of the trainings have been turned in, but just kind of wanted to remind you guys, the actual yearly site code should not be at Memorial, should not really be used for those types of plan trainings. That site code is really for just-in-time training or a quality issue or a new piece of equipment, something like that. The actual trainings really should be submitted separately so that there are no issues at any other hospital or at any other resource hospitals that EMS providers belong to. They should get a direct IDPH site code. So that's all I have, Phil.
Appreciate that, Greg. And I see Nick and Jason look very amiable to providing that briefing. So we all, them included, understand how they're set up as well. So yeah. So if that'd be great. So if we, it'd be good time to probably the best time to do it, I would say, while we do have great, I think we had around 40 on today. We'll probably have a little more on the quarterly coalition call. So whether we do it May or June, either one would work for me. And because we'll always have it posted on the YouTube page. So you guys just let me know when you would like to do that briefing, and we'll just incorporate it for that. We'll make time for it. Right. Anything else from around the coalition? Okay, not hearing anything. That takes us out to 40 minutes. You got about 20 minutes of your day back. I know the rain is starting to subside on this side, so if you're going out to grab something to eat, now would be a good shot. If you're at least you're in the Belleville area, be a good time to go out. If not, stay dry, stay safe, and we will talk at you guys next month. Take care.
Thanks, Phil. Good meeting.